Hello, my name is Dr. Janice Matala. I apologize for general appearances today. I'm still recovering from a viral illness. This is video 2 on the COVID-19 virus. In my last video, I talked about our elderly family and friends and how to help them and to keep them safe. Today, I'm going to talk about something else. As a palliative care doctor, one of the things I have to do a lot is talk to people in very hard times. And sometimes that's in an ICU. And sometimes the people who were there in the ICU that day, the day before, were not. They were fine. They were out doing their thing. They weren't thinking about things. And then something happened. They had a heart attack or a stroke or something. And now they're in the intensive care unit and their family has to make very hard decisions. I have doctors who will tell me they're not going to do well with this procedure, they're not going to do well with that, or they're not going to survive. And I have to distill all that information into facts that the family can understand and explain to them. The family then has to use that information to make the best choice for their loved ones and to make the best decisions for their loved ones. But that's very, very hard. A lot of families are very messy, for lack of a better term. We call it family dynamics. What that means is that the sister might not agree with the brother, who might not agree with the aunt, and some of these issues go way back. And maybe one family member really understands what the patient wants, and it can be very hard and a great deal of trauma for the family at that time. That's why we have a thing called advance directives. What that is that you can explain to your family what you want beforehand. There are some very informal things like the 5 wishes. But then there's formal things like the post form, which is actually a legal document. Your doctor has to sign it. And you can say, I want this or I don't want this. And the post form covers things like CPR and ventilators and feeding tubes. And you can specify all that. A lot of the post forms also have an optional section in the back where you can signify a power of attorney. A power of attorney is a person who you designate as someone who's the sole decision maker for you. This is a person you trust who will respect your wishes, who hopefully you've already talked to and said, this is what I want. And I know I can't anticipate everything the doctors are going to ask, but based on what you know about me, I'm going to trust you to make the best decision. As a result, this power of attorney knows your values enough that they can say, yeah, want this, or no, don't do that. The other things that we sometimes talk about are do not resuscitate, CPR, right? Do you want chest compressions, cardiopulmonary resuscitation, where we try to restart your heart? You may say, hey, that makes sense. I'm young, I'm healthy, or I have a heart condition. Yeah, start my heart. It's what treats my heart. Or you may say, no, I'm very old, my whole body's breaking down, or no, I have this advanced disease. It's everywhere. Nothing's going to stop it. If I die, it'll be because the heart is being dragged down by the rest of the body, or someone is so sick they're in what's called multi-organ system failure, which is one of the things we're seeing with this COVID-19. People are having multiple organs failing. Sometimes restarting the heart's not going to make a difference in that point. This, however, is a very personal decision. There's more than just healthcare. There's personal beliefs and ethics and religion and family values and the opinion of other family members. And these all factor into things. And that's why it's important to have these conversations beforehand. You want to not only talk about CPR, but breathing tubes. Breathing tubes can be very controversial for some people because in many cases they go in for just a short time and then they come out. The question is, are you someone who is so sick that they won't be able to take it out? when that happens, they put a hole in your neck called a trach, and then they put the breathing tube to the hole in your neck. And if the doctor's ever talking about doing a trach, it means they don't expect the breathing tube to come out anytime soon. Sometimes, but not very soon. And a lot of people with those holes in their necks spend the rest of their life on trachs, and sometimes it's appropriate. Sometimes people with high-level quadriplegia do fine, and some people with other diseases don't. And that's why, again, this is a thing you need to have a discussion with your doctor, with your family, about what you would want. Same thing with feeding tubes. So that's why you want to have advanced directives made, especially in these scary times when we're thinking a little bit more about death, about what could happen. This is one little thing you can do for your family, for the people you love, so they're not fighting things out in your last days. So they all have a sense of peace, of knowing this is what you wanted. Take this time when we are in isolation and have nothing else going on to maybe have these hard conversations now before they become super hard in the ICU. It will be worth it. It will be time well spent. I highly encourage it. Thank you. Stay well, stay safe.